water therapy. You're connecting with the ocean. You can leave all the stresses of your day-to-day life on the shore and then just go out.
It's been almost 2 months since pro surfer Cassia Metter has caught a wave at her favorite California breaks here in Malibu.
Oh, I'm so excited to get back in the water.
These first paddles into the surf producing yelps of excitement.
Yeah! So happy to be back in the water.
Closures around the state had strictly prohibited public access to this iconic coastline.
Having the beaches shut down has been really hard. As a surfer and as somebody that really kind of activates myself in all that I do from the ocean, it's been difficult.
After months of being cooped up at home, millions of Americans are likely feeling the same way, eager to venture into the outdoors again ahead of Memorial Day weekend. But exposure to the sun is no longer one of the big worries. Nationwide restrictions protecting beachgoers against COVID-19 vary state by state, even county by county. Many beaches requiring face masks and banning items like umbrellas, towels, and coolers, hoping to keep shorelines safe. And with infection rates decreasing this week, governors across the country agreeing to start opening beaches.
You've been noticing a little bit of a trend with ICU rates.
Deaths have decreased by more than 1/3.
Total COVID positive individuals has decreased by 21%.
Florida was one of the first states to open in early May after hosting hordes of spring breakers back in March. But issues like overcrowding have caused some cities like Naples to close, reopen, and then close its shores again. This after outrage from residents.
I'm a 51-year-old woman. I don't need parents as in the council or the government telling me how to be healthy.
Naples beaches are back open, but with various restrictions. Keeping up and enforcing all of these guidelines is a looming challenge for those tasked with protecting us, like Los Angeles County Ocean Lifeguard Specialist Pono Barnes.
We've never closed the beaches like this. There's no playbook. There's no exact right way to do it.
His unit covers 72 miles of coastline, making sure that families, like the Cyphers, with their kids once again luxuriating in the sand, can stay safe.
So this is the first thing they've actually been able to go back to your spot on the beach, and the kids are just so happy.
Yeah, it's the first day it's open. As you can see, they couldn't be more thrilled, especially with school's being shut down.
But on the first day of opening, a learning curve. Despite the health orders requiring those face coverings, we didn't see very many.
I see a lot of people not wearing masks, like these people,
like us,
like you.
Yeah.
What do you feel about the whole mask, not mask thing?
I think it's good when you're in crowds, like at a grocery store and things like that. I don't feel much of a need for it here compared to, say, going to Trader Joe's earlier today.
Let's say somebody, has a drowning incident. They get pulled off the beach. What do your lifeguards do?
We're going to doff a full isolation kit. We have gloves, masks, goggles, N95 masks, a gown and pants and shoes, and whether it's CPR or attending to someone's wound. We're gonna do everything that we normally would do with just a couple extra layers of protective equipment.
Across the country, on the East Coast, New Jersey is preparing for beaches to reopen next weekend. For Cape May, tourism has been the lifeblood of the community. County residents like 71-year-old Bill Green hoping to preserve its reputation as one of the country's oldest vacation resort destinations.
The impact that this is having on shore communities is significant. There's no question about that. It's a town that thrives on tourism, and we haven't had tourism since March.
This morning, the retired professor hit the boardwalk, passing out PPE and educational pamphlets as a social distancing ambassador, part of a new county health initiative called 6 Feet Saves. Megan Santiago and Liberty Kosis are responsible for the campaign.
A lot of people, smiled at us, thanked us.
I think prevention is key from contracting COVID-19. So if we can prevent it and just help our local hospitals out that way and help our nurses and our doctors who are on the front line.
Being a resident of a shore town is you have to be resilient. So I'm very confident that we're going to be able to pull through this.
In a typical year, Cape May County draws more than 10 million visitors.
Beaches will be pivotal. They're economic drivers. If you can safely reopen that beach and get people spending money in the beach bars, at the restaurants and on the boardwalk, it's one way to help the economy kickstart, with the bonus that everyone's having a great time.
Condé Nast Traveler contributing editor Mark Elwood says uncertainty about the safety of travel could mean more beachgoers.
It feels very intimidating to step outside your comfort zone. But we have seen that online, a lot of the searches about travel right now are saying, when will it be safe to travel? How can I travel safely? What that means is, by choice or by necessity, more Americans than ever will be heading to local beaches.
According to AAA, online bookings have been rising, though modestly since mid-April, suggesting travelers' confidence is slowly improving. But domestic flights have plunged almost 70% since last year, and this week, 7 out of 10 hotel rooms across the country are vacant. All of this has devastated Hawaii's tourism industry.
Waikiki is normally bustling with travelers. To see Waikiki now, it's a ghost town. There's no one on the beaches, the sidewalks, the shops. Hotels are boarded up. My hotel is boarded up. It's just such an extreme difference from the normal Waikiki that we know.
Wendy Perez has worked at this resort for 31 years. The once thriving strip she's come to know so well, now desolate. The tourism industry here has come to a screeching halt.
My first and foremost concern was for, my family and myself, but I'm also taking care of my 85-year-old father, and he's in the high-risk group.
She's now one of the more than 200,000 people applying for unemployment, nearly a third of Hawaii's total workforce.
You're mainly worried about your bills, your day-to-day bills or your month-to-month bills, and making sure you can cover all of those bills.
So many here can't afford to cover those bills, and many in these hours-long food lines worried about where the next meal will come from.
I know people are eager to go back to work, but I think a lot more people are eager to make sure that their health and safety is first and foremost before we go back to work. We have a lot of visitors from all over the world, so we want to make sure that our health is going to be taken care of.
From Waikiki to the breaks of Malibu, returning to the healing powers of the ocean will provide everything they need, but it's a start.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.